Hello and welcome to this lecture. Today we are going to discuss the clinical uses of cholinesterase inhibitors. So what are cholinesterase inhibitors? And these are those classification of the drugs that are responsible to inhibit the breakdown of acetylcholine. So at the end, what will happen when they inhibit the breakdown of acetylcholine into acetyl and choline? So it will help to increase the level of acetylcholine, and they are also used for the treatment of glaucoma, uh, to reduce the intraocular pressure. They are also known as indirect acting drugs, and they are also responsible for contraction of the ciliary body to facilitate the flow of adequate humor, reduce the rate of secretion. And the drugs belong to in this category are neostigmine and physostigmine. And the adverse effects are convulsions, muscle paralysis, cataract, excessive cholinergic stimulation. Why? Because of the increase of the acetylcholine. The clinical uses of cholinesterase inhibitors are in the GIT tract, is post-operative ileus, urinary retention. Most widely used drug is methancol and neostigmine via subcutaneous. Then it is also used for Mastenia Gravis, which is an autoimmune neuromuscular disease. And how it acts? The answer is that by blocking the nicotine acetylcholine receptor, and it is responsible for the weakness of the skeletal muscle at neuromuscular junction. Then we have Myasthenia gravis, which is the chronic autoimmune neuromuscular disease. And what will happen that antibodies will block the nicotinic acetylcholine receptors that result in the weakness of the skeletal muscle at neuromuscular junction, and it causes increase the degradation of the receptors and blockage of acetylcholine binding. That's the main thing. If we take a look of this picture, what is actually happening that this is the acetylcholine, and it will be released at neuromuscular junction, where the acetylcholine receptors will bind under a normal contraction process. So what happened in Mastenia gravis? The muscular contraction has been reduced. Why? Because of the formation of antibodies that block the acetylcholine receptors, and as a result that acetylcholine will unable to perform its function, and that's lead to the skeletal muscle weakness. So the symptoms occur in Myasthenia gravis are ptosis, diplopia, slurred speech, swallowing problem, fatigueness, hoarseness of voice, and limb weakness. So this is a picture of ptosis. As we know that in Myasthenia gravis there will be weakness of the skeletal muscle, so that's where unequal eyes will be seen. Then diplopia means the blurred vision that can be found. So what will happen? The clinical uses of acetylcholine inhibitors, uh, we can give this in case of atropine overdosage. So the drug will be used physostigmine, and we know that in atropine overdosage there will be increase of the temperature, decrease of the sweating, there will be confusion and delirium, and there will be tachycardia, and then there will be decrease in secretions. So cholinesterase inhibitors will be used in atropine overdosage. Then it is also used for treatment of Alzheimer disease, for the treatment of mild to moderate Alzheimer disease. And the new acetylcholinesterase inhibitors that is present in the market are donepezil, galantamine, and rivastigmine. So thank you so much for today's lecture. Hope to see you again.